Thank you for having us back. Today, I'm accompanied by Ms. Cindy Dupont, who is, as you said, Vice President in Healthcare District and directly oversee Healthcare District, School Health Program. So we came in case that you have some questions that we can cover together. Today, I'm going to give you a little bit update on vaccination efforts that we plan together with your administration, as well as overlook of where are our nurses this year and how they're working together with all schools to kind of pull this year together the best we can. This is actually a view backwards, what we did this summer, but is kind of good synopsis of vaccine initiatives that lasted around 8 weeks, finished on August 8th, just before the school started. We parked our mobile clinic, vaccination clinic on 4 different locations around the county, conveniently located on your, I believe, superintendent offices, including this location as well. So we were open on Saturdays as well, and we did anything reasonably possible that we make very accessible and easy to access for parents after hours on Saturdays, because that was very soon after the age was expanded. And during those efforts, we provided 1,400 vaccines to the kids. You can see age distribution. Majority of people receive vaccines in those locations were children, but also their families. And that's what we plan to do also in next period, that we plan to expand those on actually high schools properties, as I'm going to talk a little bit about it. So this is actually what Dr. Alonso mentioned, around 20% of total vaccination to this age group that we gave. And we are not only vaccinators in the community, but we are one of the main Pfizer providers, because not all doctors' offices offer Pfizer because it's very complex cold chain management. And for example, Publix doesn't offer Pfizer either. So we want to really be offering Pfizer wherever we can and targeting this group in particular. As I mentioned, we plan starting next week to park our mobile clinic on multiple locations, multiple high schools. We will do 2 high school locations in the same day. We're going to park in the mornings between 7 and 11 on one location, and then we're going to have 2 hours breaks. We're going to relocate on others. The goal is that during the 3 weeks, we hit all high schools, as well as middle school and elementary schools for employees who are still non-vaccinated, to kind of come on that property, to be kind of conveniently located in hours that they can maybe before the work. Another thing is that is important for this kind of approach, we need consent from the parents. Unlike testing, we need we need not only consent, but also parents' presence. So that's why we are trying to do it before and after school, maybe on the drop-off, during the drop-off time, they can accompany child and kind of get that vaccine. So the other couple slides talk about screening and testing in the schoolrooms. Last year, we thought we were busy. It's nothing compared to this year when we have all children back. But thanks to the last year experience, I think, although it's really busy and tough, I think they're doing awesome job. In this left side of this PowerPoint of this slide talks about number of COVID screenings. So those 10,000 screenings that we did in first 3 weeks of school actually are children who come to school with symptoms or develop symptoms during the hours and sent to the health room to the nurse to screen them. You can see here that 33% of those kids screening was positive, which means they had one of the major symptoms or 2 of the minor symptoms that are listed on the bottom. That nurse then make assessment and decision, this child needs to be tested. This might be a COVID. It doesn't mean it's a COVID, but she recommends testing. For children that we are able to obtain consent through the school administration, we test them right away. And that's what you now have in the right section, 3,200 students tests were collected. That doesn't mean they're performing in the schools. This is like student went home or they were tested in a school. So you can see in-house testing percentage, how many we conducted, over 1,300. You can see how many hard copies of tests we obtained, and also verbal results. This is hit and miss. Some parents don't follow up and opt to isolate the children for the rest of the time, but kind of just idea how many collected results of the test we had. Then you have in-house testing by school level. You can see elementary versus middle versus high, and the symptoms as well as gender distribution. Gender distribution is pretty equal. Boys and girls are equally tested and screened. This slide goes a little bit more in details of our in-house testing. You can see positive in the high schools, schools that are in order for the highest number of positive in-house testing. Those are the tests that nurses conducted. And you can see from the top down who are the schools that have highest, in first 3 weeks, highest number of in-house rapid antigen test positives. On the left-hand side, I love this side because it's very operational, and Cindy lives in those dashboards, and definitely segue in our mutual discussions between school district and us and Department of Health, operationally how we cover the schools. You can see ours when they're busiest doing screenings. In the right-hand side, you can see when they're busiest doing testing. So that's how we plan. That's how we can maybe sometimes move the nurse in the afternoon to some other school who doesn't have it when we are short. And that's what we are trying to really be very data-driven when we make those decisions. And I wanted to share that with you. These slides is actually my favorite because we don't do only COVID. This is kind of summary of everything that is happening in health room, and we never stop doing that. And we are still able to do with all these COVID activities. On the bottom, you can see visit type screening. 95% of the screening is still COVID, but we still do other screenings that we are obligated to the state, such as scoliosis and BMI. We started doing that. And you can see the majority of their business is screenings, but 40,000 health room visits also go to the different office visits, medication administration, procedures, as well as different consultations. And you also can see hours of distribution. You can see which schools are busiest based on all assessment on the left top section. Also distribution by type of the school on the left bottom. The right bottom talks about nurse and designees. Designees help, and this is the number of the visit the designees performed. And most importantly, you can see the majority of kids still go back to the classroom, but is our absolute priority, especially during this hard year. Absenteeism is something that is worrisome for all of us, and we try anything reasonable in our power to keep kids in the school and never send them home if it's not really necessary. You can see also emergency calls. So all in all, you can see that boys are more often in the health room than girls. I think when you break down this a little bit more, you can see a lot of scraped knees and bumped heads in the boys because this slide talks also about general office visits. And that concludes my presentation. I'm just going to finish with sharing that our cooperation between those three agencies, school district, health department, and healthcare district, was never better. I think during last year, we learned much better to work together. I think we are in a great position to have all those resources and really absolute dedication from all three agencies to help school district to have a successful year. I think resilience and hope is what we talk very often. We don't have any other choice.
Mrs. Whitfield.
Thank you so much, and I'd love to see these slides up close. They're great, but I can't quite read all the details on them. But I'm very glad you came to present them to us. I'm really concerned about the nurses in our schools and the burden that is on them. And I keep talking about burden, but it just keeps coming. So I visited a few schools this week and had an opportunity to talk to some of our nurses who are extremely overwhelmed and really need more help. Is that something that you think the healthcare district will be looking into, is trying to find, additional funds for nurses? Is that completely on us and our COVID dollars? How is it we can give more support to these
it's
nurses?
all of the above, and that's why we're monitoring those numbers and sending help and addressing this whenever we can. But Dr. Alonso said something very important. All healthcare is so short on employees that we all struggle. I mean, clinics, hospitals, school health, but I think that it's not only healthcare district issue, it's a mutual three-agency on daily basis discussions how to make this really the least painful and very cognizant of their burnout. We bring them once a month. We were just talking coming here, right? We're trying the best to listen, to see where we can help them, to utilize satellites rooms, to have designees help them best they can. But we just have to live through this.
Mrs. Andrews, then Vice Chairwoman Brew.
Thank you. And when we look at the dashboards, I think they're awesome. They help us at real time, knowing exactly what's going on. But I know when I look at the dashboard and I see sometimes elementary schools have more breakout cases, and then you see high schools in certain areas. And parents are so concerned when they look at the dashboard and they see that maybe their school had a whole lot of cases. And we're trying to be as, we're trying to have as much positive communications to parents to let them know this is a pandemic. It could happen. We don't know where a child has been before they came to school. And it's not about maybe your school in particular. It's just about where we are in life right now as we work with this virus, this COVID-19 and this Delta. And so I just want to know if as we're working as a school board, how can we try to ease the parents' minds about, you know, if it happens at their school and there's a contact trace and the children have to go home. We're really trying to make sure they have their work so that they don't miss out. We're doing everything that we can. But I always tell parents just to try to hold on because it could happen anywhere. It may not have really been at the school. They just came to school. So I think we have to kind of educate people and let them know it may not be just right at the school. It may have come to the school because they were out somewhere doing something else. So any advice can you give us so that when parents are listening to you today, first of all, I heard you, and I want people in the audience and everywhere to know that when we're talking about vaccines, we're going to make sure the parent is there. We're not talking about a note or a school taking somebody out of class or before school at lunch to give a test or a vaccine. This is with the parent. So I just want to make sure that's clear. But I also want to make sure parents know that this is so sensitive now. We don't know what could happen to any of us, and we want to try to work together. So if there's any advice you can tell to the parents that we're all working through this together. We see a little bit, you know, from the grass today, but we don't know where we'll be tomorrow. So can you share with parents what kind of things that you'd advise for them if something happened to them as it relates to their child, as far as being diagnosed quickly that they do have the COVID, or if they have to be quarantined?
I think everything that we are doing and what you are doing with increasing testing, it's going to kind of bring a lot of ease on parents, even if the kid was in the same classroom. That kind of easy, accessible testing will bring naturally some ease. But also those mitigation strategies that we are doing, kids are just reflection of our community. When the numbers go down in the community, the numbers will go down in the school, and we have less and less risk. So I think kids are at risk just equivalent to any other community. And I think mitigation strategies that we have, as well as in-school testing, that really prevents, this test that we have in schools is actually test of transmissibility. So we try to really cut early any transmissibility potential for children who have any respiratory symptoms. And adding the drive-through testing that I heard you guys are doing is actually a great avenue to ease those worries. And I'll be utilizing that a lot for my child.
Vice Chair Brew.
Thank you, and thank you again for your presentation. So you sort of addressed the biggest frustration that I'm hearing from parents whose children have been at home, have been positive, and are quarantining, is they want their child tested before they go back to school. They understand that they don't have to if there's a certain period of time that's elapsed, but they want to make sure that their children are not spreading the virus. And so thank you for the MOU, because that will help, having those two sites. It helps, and I don't want to sound ungrateful, but I don't think it's enough, because we really need more sites. And I'm just going to throw out something that I've shared with Mr. Burke as my wish list. I know you're working with us with our students, but I do hope that sometime in the not too distant future we can have some type of agreement that for our school-based staff who go to school, who are feeling fine, and then all of a sudden, and I've heard several cases where they're in the school and all of a sudden don't feel well, that we would have the opportunity to test them as well at the school sites if we could come up with a partnership. So I'm just putting that out there. Thank you.
Dr. Andrick, let me ask you a question. Would you just make it absolutely clear that you're not intending to make the vaccines mandatory for employees or staff when you visit our schools, that it's totally voluntary and there's no there's no thought on your part that we're going to require anyone to get the vaccine if they don't want it.
We don't even have authority to do that. That's,
All right, well, one of the
Totally.
speakers just suggested earlier that we were on that trail, and I just want to make sure that when
Not
they
at
hear
all.
that we're going to put testing and vaccines on our campuses, it's clear that we are not authorizing mandatory, vaccination of our employees or our
no,
students.
not at
It's
all.
Vaccination
Totally
initiatives that, and mobile clinic is coming to provide vaccine is no different than going to Publix. It's your choice to get vaccine. We're just making very, very convenient for people who maybe were too busy, and life is busy these days for parents who have multiple kids, and maybe this is a moment that they're going to stop by and get it because they want vaccine.
Okay.
So that we are just making very convenient and accessible.
All right, thank you.